Hey, John, you know what this is?
Funny money?
This is the coupon that Canadians use to get their vial of insulin. I went shopping, got you a couple items also.
But you still can't buy your insulin from Canada, David.
Welcome to CareTalk, your monthly home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Well, mostly monthly.
Yeah, John, it's nice to see you again.
Well,
usually take a long vacation. You didn't get a really tan-fastic tan this time, though. Now, John, speaking of not getting a tan, Canada. The Canadians are worried
that
the Americans are going to come up and grab all the drugs out of their pharmacies and bring them back. Are they paranoid or are they right?
They should be. They should be. Look, they sensibly negotiate with Big Pharma to get a fair price. We don't. Our prices are 6 to 10 times as high. Why shouldn't we, go across the border and buy those drugs that, for the most part, were manufactured here and priced here and then discounted by Canada? I don't think the American consumer should be denied the ability to get a fair price.
Well, John, we diss the Canadian healthcare system at every opportunity and then say, you know what? We can't solve our own problems of drug pricing, so we'll let the Canadians do it. I think what the Canadians are going to do, John, is they're going to solve it by copying our example and building a wall on the southern border of Canada and keep the drug migrants out, the troublemakers.
If they build the wall as effectively as we do, we can still go and buy those drugs. So, David, what do you think of the authorized generic?
Well, John, I'm a big believer in authority. So the idea of an authorized generic, I think, is a damn good idea.
So what is an authorized generic?
Let me explain it to you, John. So let's say you've got a big pharma company like Merck or Pfizer. Their hard-earned dollars coming to an end. Their development money has been already spent, and they're selling the drug, and the patent ends. Now, when it ends, they're going to have a cheap generic competitor come in.
The monopoly patent that they've had.
A patent. Not a monopoly patent, a patent.
Okay.
And when it's going to end, they're going to have a cheap generic competitor come into the market and trash the price,
get a fair
right?
Price, yeah.
So what they do is they have an authorized generic. They say, I'm going to put a generic on the market myself, and not only that, I don't have to pay the PBMs their rebates for that, which they don't deserve anyway, and I don't have to give Medicaid as big a rebate that they don't deserve. And plus, people see a generic, and they see a generic, they assume it's cheaper, and if they think that,
but you're misleading. The whole notion of the authorized generic is simply a way for the monopoly big pharma company that's already made plenty of money during its monopoly period to make it seem like, by using the word generic, it's like saying there's a discount when there isn't one for drugs. Look, the average American person who's on chronic meds, 1 out of 3 or 1 out of 4 people cannot afford the drugs they're prescribed for life-sustaining purposes. Prices are too high. The use of the notion of a generic, authorized or not by Big Pharma with the same brand, misleads the public. It's typically priced a lot higher. It should stop.
Fine, John, you can have the unauthorized product. Go for it. Now listen.
Works just fine.
Okay. Now, John, I know you're not a big reader, so I doubt you saw the New England Journal of Medicine. Yeah, it's got kind of some long words in it. And they wrote a perspective about accountable care organizations, and they said they're using skilled nursing facilities, that is nursing homes.
What is an accountable care organization?
As piggybanks. So an accountable care organization, the idea is to try to reduce the costs and improve the quality of care by giving a provider organization responsibility for the entire chain of a patient. So, John, what do you think about this idea about using the SNFs, as they call these skilled nursing facilities, as a piggy bank for savings for the ACOs?
I wouldn't get hung up with the individual words. Look, ACOs were designed by the federal government to try to force hospitals and doctors to manage populations and risk a little bit better. So typically they're built around hospitals. Those hospitals sensibly squeeze the supply chain of nursing homes, which is the amount of days folks would spend in nursing homes. But I got to tell you, my 85-year-old mother does not want to spend any more time in a nursing home than she needs to. And I think that's true of most people. So attacking the system for saving money and getting people directly at home, that's nuts. We should be sending more people home. At CareCentrix, that's what we focus on. And perhaps the way it's being squeezed today is to reduce days in nursing homes, but soon it'll be days in the hospital. It's a good thing. People shouldn't be criticizing. You should be ashamed.
I'm ashamed of myself, John. You're exactly right. But I'll tell you what, I think that they should do a better job of having the continuum of care as opposed to having hospitals fighting with nursing homes, fighting with the home care, fighting with your 85-year-old mother, which I would not recommend to anybody.
So David, you saw this U.S. Preventive Task Force recommendation that everyone should be screened for illicit drugs.
I read all that stuff.
You look a little agitated about this recommendation that every doctor should have a conversation about and be screening their adult patients for illicit drug use. Why does that get under your skin?
It just does, John. I'll tell you why. When I go into my primary care physician to have my annual checkup, right, instead of talking to me, she's just right on the computer. She's like a hamster on a habit trail. She has to screen me for this. She has to ask me about that. Did I wear my bicycle helmet? Am I depressed?
Well,
yeah. You know what? I'm riled up because I have to listen to all this nonsense, and I want to hear, am I using illicit drugs? They're going to say, do you use cannabis?
Slow down.
Guess what's now saleable in Massachusetts? It's legal. Okay, cannabis. 85% of the people who are adults who are using illicit drugs are using cannabis. I don't want to waste my doctor's time asking me a stupid question.
Illicit drug use is a huge and growing problem. There's a 20% of the illicit drug. 20% of all adults are using illicit drugs. Of those, perhaps only 20% are super dangerous, but I guarantee you some people are abusing cannabis. I think in the privacy of that conversation with your doctor, you shouldn't be afraid of the facts. You shouldn't be afraid of the truth. I think the doctors need more of that information. I think it's a great recommendation. And if we're going to fight over that, I think it might be time for the lightning round.
Oh, that's good, John, because I don't want any untruths that could be struck down by that lightning. John, a Montana man, was recently charged $500,000 for dialysis treatment. Should he have paid his bill?
No. There's a whole game that's being played of in and out of network that the major providers charge patients, and it's usually hidden by insurance. Don't pay it. That bill was 97 times the cost that Fresenius would be reimbursed on a per session basis for dialysis under Medicare. Don't pay crazy bills.
John, the crazy thing there is that I bet if they charged $50,000 or $75,000, the guy would have actually sucked it up and paid it.
It's unfair. So, David, climate change is clearly a healthcare issue, right?
John, I guess if your only tool is a hammer, everything looks like a nail. And no, climate change is an environmental issue, John. Okay? Not everything is a healthcare issue.
People's health. David, low-level ozone is a direct function of the heating of the earth, the fires that are coming up, and the erosion and the pollutants that naturally happen in the air, and you see it in emphysema rates. You're wrong.
So Al Gore, they used to call Mr. Ozone. He'd be Mr. Ozone Jr. John, I understand that somebody manipulated the Novartis data on gene therapy for that $2 million drug. What do you think the punishment should be for them?
Well, I think they were fired. They're moved out of the organization. I thought it was odd that it was a little bit slow, but I think the punishment of being kind of fired is appropriate. What do you think?
I think they should have their own gene edited.
So, David, some say Tom Brady's too old to play in the NFL.
John, with a coach like Belichick and the type of pass protection that he has, I think he's going to be just fine. Although, yes, I think everybody's too old to play in the NFL, John, because it's too darn dangerous. What do you think?
Look for the Patriots in the Super Bowl.
Well, that's it for another edition of CareTalk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for watching.
Hey there, listeners. Want more CareTalk? There's more to be had in our other episodes, so be sure to look for those and subscribe to CareTalk on your favorite service.